UBC Global Orthopaedics, or UBC Go, is an outreach initiative under Faculty of Medicine's Department of Orthopaedics. We work alongside healthcare providers in underserved areas to improve care for musculoskeletal trauma and disease. Global challenge of trauma identified by the World Health Organization as a leading cause of death and disability, surpassing the effect of all infectious diseases combined. 90% of road traffic accident victims in low and middle income countries don't have access to proper orthopedic care. In Nepal, we sponsor trainees like residents and fellows in the Spine Nepal program so they can become the educators in treating spinal injuries and thus fostering sustainability. And in Uganda, where around 2,000 children are born with clubfoot each year, compared to less than 400 in Canada, we're helping ease the socioeconomic burden by promoting treatment with the non-surgical Ponseti method. My name is Clara Ju, and I'm one of the current UBC Go coordinators. Now let me introduce Munita and Turan, two of our previous and current coordinators who make these programs so successful and impactful.
My name is Turan, and I'm in my fourth year majoring in biology and minoring in psychology. I've been a UBC Go coordinator since January this year, and my co-op term is ending soon, at the end of this year. Some of the ongoing long-term projects we work on as a group include coordinating UBC Go executive committee meetings, coordinating subcommittee meetings such as research, clinical, and business committees, and managing finance and budgeting for our long-term projects. And currently we're working on a scoping and a literature review. We also help managing our social media contents, doing our spotlight series, and having the website. It's been such a rewarding process to be a part of this UBC Go and to be a part of so many different projects and initiatives.
I'm Anita, and I was a Global Orthopaedics coordinator last year. We work on various projects throughout the year. A recent example includes the Seed to STEM, where we brought in Indigenous high school students and essentially exposed them to orthopedics through workshops. We're also working on a half-day course for the residents, which aims to provide information and teach about global orthopedic initiatives and their impact. So many faculty were already involved in global orthopedic initiatives on their own time without any formal UBC support. And this was a chance to bring these projects under one umbrella and add UBC institutional support. And from there, UBC Global Orthopaedics was created by Dr. Kishore Malpuri.
Dr. Malpuri asked Dr. Potter and Dr. Parani to oversee UBC Go. And Dr. Potter is now the director for UBC Go, and Dr. Parani is the clubfoot lead. And Tarini is our first ever UBC Go coordinator.
So our faculty members have been involved with many different specialties and countries for their global orthopedic initiatives. And these initiatives also include a variety of activities such as teaching, mentorship, resident and fellowship exchanges, short-term surgical trips, collaborative research, and so much more.
Under the umbrella of UBC Go, we currently have a few major projects. This includes Spine Nepal, which is led by Dr. Peter Wing and Dr. Claire Weeks, as well as Uganda's Sustainable Clubfoot Care Project, otherwise known as USCCP, and Ponseti Clubfoot Navigator, which are led by Dr. Shafiq Karani, as well as our other global partners. We also have Uganda's Sustainable Trauma Orthopaedics Program, otherwise known as USTOP, which is led by Dr. Jeff. There is a total of 47 projects that our faculty was involved in individually, and we expect UBC Go to continue to grow to include more projects in the future and to expand more collectively.
So one of our goals for Go is definitely continuing to address the sustainability of these initiatives so that there's a long-term impact of our faculty's work. With UBC Go also being a new program among Canadian institutions, we hope to inspire our younger generation of students to get involved.
These efforts help to improve the capacity for care in these regions and potentially introducing new techniques as well. We believe more lower middle income countries and low resource communities will continue to benefit from their knowledge, skills, and support. They have made a significant impact on many communities around the world, and they will continue to do so.
Thanks for learning about UBC Go. If you'd like to learn more about how to get involved, or if you have any projects you'd like support on, please refer to our Global Orthopaedics webpage on orthopaedics.med.ubc.ca.